With great pleasure, I welcome you on behalf of the board. Healthcare is approximately 20% of our GDP. That's a very important industry sector. And we are, with our association and especially with the agenda of our annual conferences, in the heart of this industry, looking at innovations and problem solving, and this is a very important industry to be associated with.
I think there's a very high energy level among the participants. I think to me that's one of the best measures of the conference. If people are engaged, if you can hear a pin drop at the end of one of the sessions because people are hanging on to the words of the speaker or the conversation between the audience and the speaker, that's a sign we've done our job right.
I would agree, and I think that there's great networking out there. It's always tough to get people back into the conference room. People are out talking, and you can see the energy out there. It's palpable.
Yeah. I'd add that I think really some of the discussions have been world class. I mean, hearing Bill George, follow someone like Regina Herzlinger and agree on certain things that are happening in Washington, D.C. and other things that aren't happening in Washington, D.C. from a healthcare standpoint is really pretty awesome to listen to. So it's been great.
Themes of the conference here were finance, policy, and innovation. And my section dealt with innovation within the healthcare delivery system. So we brought together practitioners with consultants and some policymakers and young startup companies to talk about the different types of innovation and how to go about doing that within the healthcare industry.
The panel that I was able to work with this afternoon actually took a little bit different slice at the problem of healthcare reform. Everyone has been talking so much about what's going on in Washington, which has really ultimately become about insurance reform. And what I was able to do with the 5 companies that we talked to was look at companies that are really driving and focusing on and empowering individuals to make positive, healthy lifestyle changes. I believe that that really is the essence of what will constitute true healthcare reform, because unless we get Americans as individuals and as a population to be healthier and therefore less reliant on the system, less demanding of expensive interventions, we will never really get our arms around the healthcare cost crisis.
I think one of the things I like very much about the people we do select is we try to get both the executive leadership, so CEOs of important companies or startup companies who've got interesting ideas, and combine them with the thought leaders in the space, people like Gary Pisano, Reggie Herzlinger, who've got the new ideas. And then we tie it around with this crimson bow that makes it all very collegial. And I think that's a kind of a magic package, and that's where a lot of the energy and the vibe comes from in the conference. The part of the conference that I was responsible for organizing was part of the policy speakers and then some of the innovation speakers. And to me, that's one of the most exciting interfaces that there is, because major changes are happening right now in U.S. healthcare policy that will reverberate around the world, and it's going to depend on people like the people in the audience today to respond to those, bring innovations to bear that will take advantage of the new markets that will be created by the changes in healthcare policy.
I don't think you're going to be around for 5 years, and they don't want to get in bed with the insurer for 5 years. So I talked about these 2 paths of healthcare reform and the opportunities for innovation that a consumer-driven system, which I believe is where we will wind up, creates for entrepreneurs to do good and to do well.
And I believe the theme of the conference is to try to get out of the healthcare mess in which we find ourselves, and it is hoped that through innovation we can achieve part of that goal. As I say, I think the best chance for reform is through organizational and managerial innovations. This conference is produced in association with the Harvard Business School. If anybody can do organizational innovations, they're the guys.
The final section of our agenda was based in the finance area. So, given the terrible times economically that our country is in and the world's in, having a leader like John Thain speak, having been the chairman and CEO of the New York Stock Exchange for a number of years, and also chairman and CEO of Merrill Lynch, we thought just went over really well. And he set a nice tone you know, in talking about where the economy's been in the last 5 to 10 years, where it is now and where it may be going, and it was very productive.
Harvard Business School has a very important role to play in shaping what happens in healthcare. And so I think it's just terrific that we have an alumni association that is so active, and the conference provides a great vehicle to get them together, to expose them to new themes, new issues on the agenda, and it just creates vibrancy for that community. And I think they have an extremely important role to play.
What I really enjoyed about today's Alumni Conference, the 10th, was you had people that were running hospitals, people that were involved in insurance, people that were involved in venture capital, and also a lot of people that were trying innovative private sector solutions to healthcare problems. And I was excited to be able to be part of that debate, to step back and say 60–70% of our total healthcare spending is on chronic disease and preventive care and primary care. There we need to be thinking about a 10 or 20 year time horizon of what we do today that reduces complications 20 years out.
There were some people talking very well about how maybe that can be made to get people to do better things for their health that prevent problems as you age. Because as you age, you definitely are going to have more problems that way. And the people here are very good. They're very good at what they do.
Sometimes we go to a conference like this and, you know, we actually meet someone who needs legal help right away and we get clients out of it, but that we don't really look for. It's really part of our effort to maintain and enhance our network, which both benefits us and benefits our existing clients, to allow us to know people in the right places and help our clients navigate to the right places.
This is the most important time almost historically for healthcare in the United States, and it's incredible that we have access to people who are in the midst of the decision making right when it's happening. So we had the speaker this morning who moderated the panel and obviously has a lot of insight into what's going on. The Marwood Group has presented a couple of times, and I find them to be extremely helpful. So I think that you get a level of insight into the mechanics of how the reform might take place that you probably won't be able to get anywhere else.
It's a great chance to get together with a lot of old friends and to make new ones and to walk away with really solid take-home ideas that I can use.
You know, it's been very interesting as a physician in practicing myself. I see patients every day, but just having a discussion that we had about insight and seeing the patients really from their own point of view, I think that in itself gave a different angle to what I see every day. And it's just been very interesting, as always, a lot of heated discussion on every side of the issues.
There are people here from all aspects of the healthcare industry, and people who have run companies, people who have built and sold companies, and I think that the networking that happens informally between the sessions, over lunch, over cocktails in the evening, is probably the most energizing part of the entire conference.
Well, Schumpeter is the person who put into mainstream economics the notion of innovation, the notion that entrepreneurial innovation drives the economy forward and leads to economic growth.